Don, if most hormone problems are lifestyle based, then do we need to take bioidentical hormones?
That's an excellent question. If you think about, first you got to know what lifestyle based means. Okay. And everybody knows that you've heard the term lifestyle, but I don't say sometimes people they don't connect what that means. And that means the way that you are living, how is that contributing to either your health or the conditions that you might be suffering from? So when you look at the lifestyle problems that are really prominent, we know stress, it's a catch-all term, it's a big word, right? But specifically there are types of stress that do what I had mentioned a little bit earlier. They raise your adrenaline and cortisol levels. That's the kind of stress that you have to be very, very careful of. Yes, because if you're able to expend the energy that stress gives you, think your boss yells at you or you get into a conflict with somebody or traffic or whatever. We have to be able to expend, that's how we're designed. Once the stress hits you, you got to be able to do some fight or flight. And we're designed to have to expend that energy. But just imagine, the boss yells or whatever, you get this influx of hormone and you just sit there worry and stew in the whole thing. You're literally, these hormones are incredibly powerful. They're just ripping into you're just tearing your metabolism up. And you just sit there and stew in this toxic soup of this very powerful hormone. So this is the lifestyle things that you really have to try to avoid. So again, we go back and look at bioidentical hormones and where are they appropriate? Two places. One is they're appropriate in the woman that says, I'm not changing any of my lifestyle, I don't care what you say, I'm going to do what I want to do, and that's that. So you're going to do damage control for that person. If they don't want to change anything, let's at least help them in some way. Not my choice, not somebody that I necessarily want to work with, but that's one example. The other example is we have to distinguish who we're talking about. Like I said earlier, if she's younger, the lifestyle things younger people respond so quick to the right lifestyle adjustments and to the right natural catalyst that can really help them. All right, they respond fast. The premenopausal woman, like I said before, there's an appropriate time for them to do that, but they want to be careful because they're in this fluctuating problem. If we can just stop the damage and stop the increase of those big hormones, the spiking of the big hormones, I know we can help the little hormones. They just need to make the adjustments. Now, a woman who is postmenopausal, meaning after menopause, I think there's a very strong reason for them to consider, first, very low dose estrogen and or progesterone replacement. There's a reason for that, but you don't want to just go diving into these large doses of hormones, even if you're a postmenopausal woman because your hormones are very low then. But you don't need those hormones, or they wouldn't have been falling to begin with. What happens to a menopausal woman is they typically gain a little bit more weight. They're not supposed to gain a lot, but they can gain a little bit. Why? That's the body compensating, saying, I'm not secreting so much estrogen from my ovaries anymore. I need a little more body fat because that makes estrogen. That's how you compensate for it. But not 50 pounds. That's what happens to a lot of women, you see. And that's part of the whole lifestyle problem, is the weight gain, the low sex drive, and the hot flashes and the night sweats. It's all related to the lifestyle problems first. And we have to back up and go big hormones first, correct the big hormones, the little hormones will line up, and then you judge that woman by what kind of response are you getting from her. And if she's not getting the kind of response that you would really like for the older woman who's post-menopause, then a little bit of estrogen and progesterone therapy could work wonders, for her. She might need that because there was a lot of abuse that took place prior, and she just might not have the oomph and the energy to rebuild it. But that's bioidentical hormones they can really work wonders, but doctors, they have to be careful just giving them willy-nilly to anybody, just testing blood and going, oh, well, you're low in this and low in that. But why are you low in it? That's the question that we're answering that I think needs to be answered. Yeah.